Hi guys, my name is Dr. Promise and welcome to another episode of Inside Medicine, where we simplify hot topics and empower you on a journey to better health. Today, we're diving into a topic that affects so many Americans today, and that topic is called diabetes. I'm sure you know a family member who have been diagnosed with diabetes, whether it's a mom, a sister, or a daughter, or a cousin, whoever it is. Diabetes has touched so many lives in America today and we're going to talk about it. Now, let's get right into it. What is diabetes? It's a chronic medical condition that affects how your body processes food and turn it into energy. Most of the food that we eat is broken down into sugars and glucose, and it enters into our bloodstream, and our blood sugar tends to go up. Now, we have an organ in our body called pancreas. Pancreas is a small little organ that is responsible for producing what we call insulin. It releases a hormone called insulin that helps our body absorb the sugar that we use and turn it into energy. Patients who are living with diabetes either have one, they don't make enough insulin or don't produce any insulin at all. Now, there are two main types of diabetes. The first one is a type 1 diabetes, and the second is a type 2 diabetes. Now, the difference between these two is the presence or absence of insulin. In type 1 diabetes is typically diagnosed at a very young age, especially in children. And one of the main reason or one of the most common cause of type 1 diabetes, it's an autoimmune condition where the body attacks itself and prevent it from producing insulin. So in type 1 diabetes, they don't have any insulin production at all. Now, in type 2 diabetes, this is far more common in America today, diagnosed at a later stage in adulthood is where our body becomes very resistant to insulin or doesn't make enough insulin that help regulate our blood sugar. We also have a different type of diabetes that commonly affects pregnant females, and that's called gestational diabetes. This typically resolves after pregnancy and usually doesn't come back or can come back later in a later stage or 10 years later. But we're not going to talk about gestational diabetes as I am not an OBGYN, but I can talk more specifically as an internist right now about type 1 and type 2 diabetes. Now, why is diabetes so important? First of all, it affects 1 in 10 Americans today have diabetes and they don't even know it. Or two, they know they have diabetes and are not properly taking enough measures to control their diabetes. Another thing that I've seen so far in clinic, especially with patients that comes to see me, is they don't even care or they don't understand the implications of diabetes or untreated diabetes. There are so many signs and symptoms that you watch, especially in your children. If you notice that they're urinating more frequently, becoming more thirsty, more hungry, they're getting fatigued, they're having tingling and numbness. If you yourself have diabetes and you were diagnosed at a very young age, your chances of transferring the diabetes to your children is very high. So these are the things that you need to look out for when you have kids. Some people have no symptoms at all. They just come to clinic. We do a regular blood draw and we see that the glucose level is 200. Now, that's an automatic diagnosis for diabetes. When you have a one time blood reading of over 200, whether you're fasting or not, that's a diabetes diagnosis. Now, we can talk about A1C. To diagnose diabetes, your doctor, when she sees that regular blood draw of a glucose of an astronomical amount, she goes ahead to order what we call an A1C. This tests your blood glucose level over a period of 3 months. And we're looking for a number that is greater than 6.5%. That's an automatically diagnosis of diabetes. When you have an A1C greater than 6.5, you are considered diabetic. Now, a lot of people I've seen can be in the pre-diabetic range. The pre-diabetic range is usually between 5.7 and 6.4. You're in the pre-diabetic range. When I see a patient in clinic and he or she's in the pre-diabetic range, there is one thing I do where I look for their BMI. If they have a BMI of over 25 to 30 or they're obese or over 30, I instantly try to recommend some type of medication to help control their prediabetes so they don't end up becoming diabetic. Usually, I try to start with what we call metformin. I try to start at a very lower dose, like a 500 milligram twice daily, if they're pre-diabetic and they have a BMI of over 25 or 30. I usually try to start a medication to help because some of this medication, especially metformin, has a very good beneficial effect when it comes to weight loss, but it's a very minuscule effect of weight loss that comes with the medication called metformin. The second thing that I look for when you have an A1C over 6.5, I also look at your blood pressure. If you have an uncontrolled blood pressure, you're having blood pressure ranges over 140 systolic or a diastolic over 90, that tells me that there's something wrong and I need to do something else. I need to start you on a medication because your blood pressure can affect your risk of developing other complications from your diabetes. Another thing that I look for is your cholesterol. Usually, any patients, whether as soon as you're over the age of 40, I'm checking all the labs. I'm checking your A1C, I'm checking your cholesterol, I'm checking your blood pressure. These are the main things that can cause and worsen your heart disease and lead to an increased cardiovascular health risk. So, when you have elevated cholesterol, whether it's like a HDL or triglycerides, those put you at a higher risk of heart disease and can worsen your diabetes. Now, let's talk about the four main pillars of diabetes management. One is healthy eating foods that are less in carbs, focusing more on fibers, protein, and low glycemic foods. Foods that are less in processed foods, like less sugars, less sweeteners, physical activity, making sure that you're working out at least 30 minutes a day can make a difference. And then when you're diabetic, we have to talk about all the medications that you can help to decrease your insulin. So now let's talk about medication that we use to treat diabetes. There are so many different medications to use, and those can be tailored towards your specific needs. We look at BMI, we look at cholesterol, we look at history of heart disease. Have you had a heart attack in the past before? Do you have a stent that have been placed in your heart? There are so many things that we put into perspective to figure out the medication that will be right for you. So which is why I recommend to talk to your doctor and make sure that you're going to your annual screening and 6-month blood draws to check all these things. If you're diabetic, make sure that you're on the right medication. There's so many different medications in the market that we can use right now. And we have metformin. When you're diabetic, I do recommend a dose of at least 1,000 milligram twice daily. As long as you've been diagnosed with diabetes, make sure you're starting on that 1,000 milligram metformin twice daily. Now, there's so many indications where metformin may not be a good option for you, especially in patients who have chronic kidney disease or stage 3B, stage 4. Those medications are no longer considered effective because they tend to build toxicity and can lead to an increased risk of lactic acidosis. So we tend to stay away from metformin when you have an additional component of chronic kidney disease. There are other medications that I do recommend. Insulin has been one medication that we typically use in type 1 diabetes and also in type 2 diabetes. We usually do a basal insulin, meaning that it's insulin medication that you give yourself at night and can last for at least 12 hours, and a preprandial insulin regimen that we typically give before every meal, which is why it's called preprandial. We can also do sub-Q shots that we typically give. So you can use an insulin regimen. I've seen patients who use 30 units of basal and supplements. We just have to figure out which one is right for you, depending on what your A1C is. Now, if you have an A1C of 10 or 15, they tend to require a higher level of insulin to be able to bring down the A1C. There are other also medications like the GLP-1s. This is a new medication that is currently being used right now. It has a very significant benefit, especially in cardiovascular mortality. I highly recommend patients who do have a history of coronary artery disease, who have had a heart attack before, had stents, had a bypass before, to be on a GLP